All right, let's dive deep into a topic that, well, it carries a heavy weight in the equine world. Infectious abortion in mares. We're taking a stack of sources you've provided, and our mission today is really to unpack them. We want to understand what causes these losses, how they happen, how we figure out what went wrong.
And crucially, what can actually be done to try and prevent them.
Exactly.
And this isn't just a clinical issue, as you know. It represents a significant emotional and financial loss for anyone involved in breeding horses.
Absolutely.
And while there are non-infectious causes, your sources make it pretty clear that infectious agents are, well, a leading culprit. They account for a substantial percentage of pregnancy losses.
Yeah.
You should prepare for some surprising details extracted from this material.
Speaking of surprising, your sources mentioned something called abortion storms, linked to things like equine herpesvirus, but also mare reproductive loss syndrome tied to caterpillars.
Yeah.
Okay, that definitely got my attention early on.
It really highlights the diversity of the challenge, doesn't it? But let's start with the basics from your sources. What exactly are we talking about when we say infectious abortion?
Right, the definition.
It's generally defined as fetal loss occurring after approximately 40 days of gestation.
Okay, so past that very early stage.
Yes, resulting from microorganisms invading the mare, the placenta, or maybe the fetus itself.
And the sources give us a scope. Infectious causes are responsible for roughly, 5 to 15% of all abortions reported? That seems like a significant chunk.
It is, yeah. And the potential for these abortion storms where multiple mares abort on a premises, that really underscores the impact, especially with highly contagious agents like EHV1.
Or those caterpillars.
Or the unique environmental circumstances behind MRLS, exactly. The sources list a really broad array of potential culprits. Viruses, bacteria, rickettsia, protozoa, fungi, and that fascinating MRLS ingestion issue we just touched on.
That's quite the rogues gallery. Where do we even start unpacking these?
Well, let's begin with the usual suspects, the viruses, and specifically the one that really stands out globally according to your sources, equine herpesvirus type 1, or EHV1.
EHV1. Yeah, that seems to be a real multi-thread agent. It can cause respiratory issues, the neurological form, EHM, and abortion.
Exactly. It's the leading viral cause of abortion worldwide. And what's particularly tricky about EHV1 abortion, and this is a key insight from the material, is that it typically happens late in gestation, usually after 7 months, often between 7 and 11 months. And the mare frequently shows no clinical signs right before the abortion.
None at all.
She can seem perfectly normal one day and have aborted the next, maybe some mild fever or respiratory signs weeks earlier, but often nothing obvious right before.
Wow. That must be incredibly frustrating for owners and vets alike. So how does this silent attacker actually work its way to causing abortion?
The sources describe the pathway pretty clearly. A mare typically gets infected via the respiratory route. The virus can then establish a latent infection, sort of hiding in the body.
Okay, lying dormant.
Right. Then stress or other factors can cause the virus to reactivate. That's called recrudescence, leading to a viremia.
Meaning virus in the bloodstream?
Yes, the virus is circulating in the bloodstream.
And from the blood, it targets the placenta.
Precisely. It spreads to the placenta and causes damage to the blood vessels there, things like vasculitis, thrombosis, necrosis, basically inflammation and clotting and tissue death.
Okay.
This compromises the critical function of the placenta in providing oxygen and nutrients.
We get that supply line.
Leading to placental insufficiency and fetal hypoxia. That's a major trigger for fetal death, though direct fetal infection can also occur.
So the damage to the placenta essentially starves the fetus of oxygen. What would you find if you examined the aborted fetus or placenta in an EHV1 case?
The sources provide some key details here. The fetus is often described as looking fresh, not autolyzed.
Not broken down.
Exactly, because death and expulsion happen relatively quickly after that acute placental damage. Grossly, you might see widespread hemorrhages, pulmonary edema, and importantly, an enlarged liver with yellowish white spots.
Okay.
But the critical diagnostic nugget, the thing often seen on histopathology, are intranuclear inclusion bodies.
Inclusion bodies?
Yeah, basically the viral fingerprints inside the cells in fetal tissues like the lung, liver, adrenal gland, and thymus.
The viral calling cards.
Yeah.
Got it. What about the placenta itself?
Placental lesions can be present, like edema or necrosis, but they're noted as being quite variable, not always a specific picture there.
Okay. Shifting gears to another significant viral player mentioned, equine viral arteritis, or EVA. How does the picture differ with EVA?
Well, EVA, caused by the equine arteritis virus, often has a slightly different presentation. Transmission can be respiratory, yes, but venereal transmission through carrier stallions is a critical factor mentioned.
Carrier stallions, right.
And unlike the often asymptomatic EHV1 abortion, mares infected with EVA usually show systemic signs before they abort.
Oh, okay. Like what?
Things like fever, depression, maybe swelling around the eyes, limbs, or the mammary gland, conjunctivitis, that sort of thing. This typically happens about 7 to 10 days before the abortion occurs.
So you might get a bit of a heads up with EVA, whereas EHV1 abortion is often a complete surprise?
Generally, yes. And the abortion itself with EVA usually happens after 3 months gestation.
And what about the fetus with EVA? Fresh like EHV1?
No, actually, the sources note that EVA fetuses are often autolyzed.
Meaning they've started to break down.
Right, likely because they've been dead in utero for some time before being expelled. And placental lesions tend to be less specific compared to EHV1 or, say, some bacterial causes.
Any other viral causes worth a quick mention from the sources?
EHV4 is mentioned as a very rare cause of abortion, and EHV2 even less so. The sources also touch on a recent correlation between vecivirus antibodies and abortions, though it sounds like research is ongoing there. Equine infectious anemia is listed, but a direct causal link for abortion isn't firmly established in the material, and West Nile virus is noted as just a rare possibility.
All right, let's move on from viruses to bacteria.
Yeah.
Sounds like a different pathway is often involved here, maybe starting from the outside in.
Exactly. That's a good way to put it. The most common route for bacterial abortion is what's termed ascending placentitis.
Ascending, meaning bacteria come up through the cervix.
That's right. They typically gain access through the cervix. This is often facilitated by factors like poor perineal conformation.
Like the mare's physical structure back there?
Yes, or previous trauma that compromises the vulvar seal. This allows environmental bacteria like the frequently isolated Streptococcus equi SSSP zooepidemicus, that's the most common one,
Okay.
or things like E. coli, Klebsiella pseudomonas, to ascend into the uterus and infect the placenta.
And they seem to target that area near the cervix, the cervical star, you called it.
Yes, that's where the infection often localizes initially. It causes inflammation and necrosis of the choriolantua, that crucial placental layer.
Okay. Damaging the placenta again.
Right, compromising nutrient and gas exchange. This again leads to fetal hypoxia and death.
And what physical signs might a mare with this kind of bacterial placentitis show? Is she sick, like with EVA?
Usually not. That's a key difference. The mare herself is usually not systemically ill with this type of ascending infection.
Huh. So what do you see?
A classic sign and a real key takeaway from the sources is premature udder development and often lactation. Bagging up early.
Why does that happen?
It's thought to be because the stressed fetus is releasing cortisol, which signals the mare's body to prepare for an early birth, essentially.
Interesting. Anything else?
You might also see a purulent vulvar discharge, though the sources say it can be subtle and easily missed. An abortion typically occurs in late gestation, between 8 and 11 months, usually.
So unlike EVA, the mare usually seems fine systemically, but the udder gives it away sometimes.
Often, yes. And the fetus, in these cases, frequently autolyzed.
Broken down again. Why?
Likely due to the more chronic placental compromise before fetal death actually occurs. And the placenta itself will show characteristic lesions thickening, edema, necrosis, specifically at the cervical star, often with a kind of brownish exudate.
There's a specific type mentioned, too. No cardioform placentitis. How is that different?
No cardioform placentitis is distinct. It's caused by a different group of environmental bacteria. These are actinomycetes like Amyclotopsis and Crosella.
Okay.
While it also causes placentitis and late gestation abortion with similar mare signs premature udder, maybe discharge the sources point at a couple of differences.
Like what?
The placental lesions are often located elsewhere on the placenta, not just localized at the cervical star, sometimes at the base of the uterine horns. And they're characterized by this thick, mucoid, brownish exudate and necrosis. Also, the fetus in these cases is often fresh, not autolyzed.
Huh. Interesting differences.
Yeah.
It sounds like environmental bacteria are a big factor with these types of placentitis. What about leptospirosis? That's bacterial too, right?
Yes, leptospirosis is another bacterial cause. It's transmitted via contaminated urine or water, often linked to wildlife contact or, swampy areas.
Right.
The sources mention serovars like Pomona and Grippo tifosa as common in horses. It's well known for causing recurrent uveitis, moon blindness, but it can also cause late gestation abortion, typically between 6 and 11 months. The mare herself is often asymptomatic when she aborts from lepto.
Anything else to know about lepto?
A key insight here is that leptospirosis is zoonotic.
Meaning it can spread to people.
Yes, it can be transmitted to humans, so handling aborted materials requires extra caution.
Got it. Any specific findings with a lepto abortion?
The aborted fetus might be jaundiced, sort of yellow with an enlarged yellow liver. Placental lesions tend to be relatively mild compared to other forms of placentitis.
Are there other bacteria involved, maybe ones that were more common historically?
Salmonella abortus equi is mentioned as historically important, known for causing abortion storms, although it's apparently less frequent today. And Rhodococcus equi.
The full pneumonia bug.
That's the one. Primarily known for full pneumonia, but it can rarely cause abortion through something called granulomatous placentitis.
So bacterial issues often seem to be about access conformation, environment. What about fungi?
Fungal or mycotic placentitis is another cause listed in your sources. The common culprits here are usually Aspergillus and sometimes Candida.
And is the pathway similar to the bacterial type coming up from the cervix?
Usually, yes. Ascending infection is the typical route. It leads to thickening and necrosis of the placenta.
MRSA similar too.
Yes. Similar to bacterial placentitis, premature udder development, potential discharge, and abortion typically occurs in the second half of pregnancy.
Any telltale signs on the placenta?
A key diagnostic feature mentioned is that the placenta often has these thick, leathery, necrotic areas. Sometimes it forms a distinct donut lesion around the cervical star. And of course, histopathology to identify the actual fungal hyphae is crucial for diagnosis.
Okay. Moving further down the list in the sources, protozoa, are they a big factor?
Protozoal causes appear less common as direct proven causes of abortion based on your sources. Sarcocystis neurona and Neospora huiesi, which are known for causing EPM.
Right, the neurological disease.
They have been reported in aborted fetuses, but the direct causal link for S. neurona causing abortion specifically seems, well, less clear in the literature provided. Toxoplasma gondii is also mentioned as rarely implicated.
All right, this brings us back to the truly unique one you mentioned right at the start, the one that sounds like something out of science fiction. Mare reproductive loss syndrome, MRLS, and it's linked to caterpillars.
MRLS is, it's a fascinating and significant issue, particularly when populations of eastern tent caterpillars explode or potentially other caterpillar species that have these barbed setae, these hairs.
Yeah.
The association is strong and tied directly to environmental factors.
So the mare ingests these caterpillars or parts of them.
That's the leading theory based on the research you provided. And here's where it gets really interesting. A key insight into the mechanism. It's not thought to be a simple toxin from the caterpillar itself causing the abortion anymore.
Okay.
The currently theorized pathogenesis is that the barbed hairs, the setae...
The little caterpillar hairs?
Yes. They cause microscopic punctures in the mare's bowel wall.
Wait, punctures? In the gut wall? From hairs?
Tiny ones, yes. And bacteria, either contaminating the setae themselves or already present in the gut, can then gain access to blood vessels through these microscopic punctures.
Whoa.
They then migrate within the blood vessels as what the sources describe as septic sedal emboli.
Septic settlement. So, bacteria traveling on fragments of caterpillar hair through the bloodstream, that's truly surprising.
It is an incredibly unusual mechanism. These septic emboli then deposit in vascular targets, particularly in the fetus and placenta, causing infection and ultimately abortion.
What kind of bacteria are involved?
The bacteria most often isolated in these MRLS cases are Actinobacillus and non-hemolytic Streptococcus, identified in about 65% of MRLS abortions according to your sources.
So it's a physical trigger from the caterpillar hairs that facilitates a secondary bacterial infection, not some primary caterpillar toxin.
That seems to be the current understanding presented in the material, yeah. It challenged the initial toxin theory that came about after that large Kentucky outbreak back in 2001, 2002.
Right.
And the sources note MRLS can cause both early loss around 450 days and also late abortions over 269 days.
Wow. From common viruses to environmental bacteria getting in because of conformation to caterpillar hairs causing bacterial infections. The complexity is really striking. If we step back for a second, how do all these diverse causes ultimately lead to the pregnancy loss? Is there a common theme?
Well, if we connect this to the bigger picture, the sources synthesize the general pathways. The most common mechanism, particularly with bacterial and fungal causes, is placentitis.
Damage to the placenta.
Right. The infection and inflammation severely compromise the placenta's function in supporting the fetus. That leads to hypoxia, maybe malnutrition, and that can trigger premature labor or luteolysis, the breakdown of the corpus luteum maintaining the pregnancy.
Or sometimes the pathogen just directly attacks the fetus.
That's the other main pathway, direct fetal infection, where the pathogen causes systemic illness and organ damage right in the fetus, leading to death in utero.
And what about the mare getting sick? Does that cause it?
Less commonly, yes. Severe systemic illness or endotoxemia in the mare could impact the fetus. But typically, the abortion event itself seems driven more by the placental issues or direct fetal problems rather than just maternal systemic disease.
So, thinking about the owner or manager on the ground, what might you actually see in a mare that signals something is wrong?
That's a critical question, and it really raises a challenge highlighted repeatedly in the sources. Pre-abortion signs in the mare are often absent.
Especially with EHV1, you said.
Exactly. You might not see a single thing until the mare has already aborted.
But sometimes there are clues.
Yes. If present, signs often manifest in the second half of gestation. The classic sign we talked about is premature mammary development, bagging up, and sometimes lactation. That's a big red flag suggesting placental compromise.
Okay.
You might also see vulvar discharge, which can range from obvious pus to something quite subtle. Systemic signs like fever, depression, or anorexia can occur, particularly with diseases like EVA, as we mentioned. Or sometimes the mare simply fails to deliver on her expected due date. She goes overdue, but nothing happens.
And on a physical examination by a vet, what might they find?
Again, the mare might appear completely normal before the abortion, or they might find fetal or placental tissues protruding, or evidence of a red bag delivery that's premature placental separation.
Right.
They might see that vulvar discharge, or confirm the premature udder development. And of course, complications like dystocia, a difficult birth, can occur, or signs of systemic illness if the mare develops secondary issues post-abortion.
Given the potential impact, identifying risk factors seems key. Who's most vulnerable to these infectious abortions?
Your sources outline several significant risk factors. A big one is mixing pregnant mares with young horses, or horses that are in training or traveling frequently.
Because they shed viruses more.
Exactly. These groups are more likely to be actively shedding respiratory viruses like EHV1 or EVA. Bringing immunologically naive mares that haven't been exposed before, into an established herd or an environment where these infections exist is another clear risk.
Makes sense. Travel too.
Definitely. Pregnant mares traveling to shows or sales also increases their exposure risk.
And we talked about the mechanics of ascending infections. I assume poor perineal conformation plays a significant role there as a risk factor.
It absolutely does. Poor vulvar angle or conformation, or previous trauma that impairs the vulvar seal, significantly predisposes mares to ascending bacterial and fungal placentitis. That's a major management consideration. Concurrent maternal issues, like GI disease or even EPM, are also listed as potential risk factors. And of course, the environmental factors we discussed, having large numbers of eastern tent caterpillars on your property, or being located in an area known for MRLS or maybe no cardioform placentitis, those are undeniable risks.
So despite best efforts sometimes, an abortion occurs. How do you solve the mystery of what actually caused it? The diagnosis.
This diagnostic step is absolutely paramount. Your sources really emphasize that obtaining a definitive diagnosis is critical. It's essential for implementing the correct prevention strategies for the rest of the herd and for making informed decisions about that mare's future breeding career.
But diagnosis isn't always straightforward or successful, is it?
That's a key challenge highlighted. The sources indicate that a definitive diagnosis is achieved in only about, say, 50 to 60% of cases overall.
Only about half.
Sometimes, yeah. And if samples are limited, poorly preserved, or the fetus is severely autolyzed, that success rate can drop significantly, maybe even lower than 30%.
Wow.
This really highlights why collecting the right samples and collecting them properly is just so incredibly important.
So what's the most important sample or step then?
The sources are very clear on this.
Yeah.
Submitting the entire fetoplacental unit, the fetus, and the whole placenta to a diagnostic laboratory is the single most important step you can take.
The whole thing?
The whole thing. And it needs to be transported, chilled, kept cool, but absolutely not frozen.
Why not frozen?
Freezing can damage the tissues and degrade the pathogens, making tests like histopathology or even culture much less reliable.
Okay, chilled, not frozen. Got it. And what specific samples and tests are the labs looking for once they get it?
It's quite comprehensive. From the fetus, they'll want things like fluids, thoracic, abdominal, serum if possible. Stomach contents are very important. And then both fixed in formalin and chilled tissues from various organs: lung, liver, thymus, kidney, brain, adrenals.
And the placenta.
The entire placenta should ideally be submitted, again with sections fixed and parts chilled. They pay particular attention to the cervical star area, but examine the whole thing.
What about samples from the mare herself?
Yes, that's important too. Paired serum samples, one taken around the time of abortion and another about 21 days later, are essential for serology looking for a rise in antibody levels.
Okay.
Plus, swabs if there's any vulvar discharge, maybe urine for lepto testing, and blood if she's showing signs of systemic illness.
And what tests do the labs run on all this?
They perform gross pathology, just looking at the tissues, and then histopathology, examining stained tissue sections under the microscope for characteristic lesions like those EHV inclusions or signs of placental inflammation and necrosis. Microbiology involves culturing samples, especially fetal stomach contents and placenta, for bacteria and fungi. And then there's PCR.
Molecular testing.
Right, polymerase chain reaction. It's highly sensitive for detecting the genetic material of specific pathogens like viruses, EHV14, EVA, or some bacteria like lepto. Serology on the mare's paired samples looks for those rising antibody titers indicating recent infection. Sometimes specific stains or tests like immunohistochemistry are used too.
And the vet is simultaneously thinking about non-infectious causes during this whole process, I assume.
Absolutely. That's a critical part of the differential diagnosis. The vet has to consider and rule out things like twinning, which is a very common non-infectious cause of abortion, umbilical cord abnormalities like excessive length or torsion, non-infectious placental issues, nutritional deficiencies, exposure to toxins like fescue grass, or even maternal factors like age or systemic disease that might not be directly infectious but could contribute to the loss.
Okay, so you've hopefully gone through the diagnostic process, maybe gotten an answer, maybe not. What happens next for the mare herself? Is there treatment?
Well, the tough part is, in most cases of infectious abortion, once it's actually imminent or happening, there's generally no treatment that can save the fetus. The process is usually too far along.
No way to stop it once it starts.
The sources note a potential very slim exception for maybe very late gestation placentitis, say after 270 days, or perhaps cases of endotoxemia if the fetus is still considered viable and the mare is very close to term.
So very specific circumstances.
Very specific, carefully managed situations. In those rare cases, there might be an attempt to maintain the pregnancy with intensive support. Otherwise, the focus shifts entirely to the mare after she has aborted.
What's the goal of treatment post-abortion then?
The primary goal is usually prophylactic therapy, trying to prevent or treat complications in the mare, specifically metritis or endometritis, uterine infection, that can easily occur after an abortion.
How is that done?
It often involves intrauterine lavage, flushing the uterus, and potentially systemic antibiotics or NSAIDs, non-steroidal anti-inflammatories. If the mare shows signs of systemic illness, septicemia or endotoxemia, or is at high risk for laminitis.
The hormone alternative progestin is mentioned in the sources in this context too.
Yes, alternatives like Regimate can potentially be used in those very specific circumstances we just talked about, cases of endotoxemia or placentitis after 270 days if there's still hope of maintaining the pregnancy and the fetus is viable.
Yeah.
But it requires really careful monitoring, potentially including hormone levels. And a critical practical note for anyone handling it is that alternagist is readily absorbed through the skin, so wearing gloves is absolutely essential.
Good safety tip. Is there an alternative?
Injectable progesterone is listed as an alternative in the sources.
And what about basic nursing care for the mare afterwards?
Most mares actually recover physically quite well unless there are complications like a retained placenta, severe metritis, uterine trauma, or secondary issues like laminitis. Paddock exercise for observation is usually fine unless those complications arise. Diet is typically monitored but doesn't usually require special changes unless there are concurrent issues like laminitis or GI upset.
Any surgical consideration?
Only really if needed to resolve complications like dystocia during the abortion itself, or perhaps performing a Cass-Lixox procedure later if poor conformation contributed and needs to be addressed for future breeding.
And communicating all this complexity to the owner is obviously important.
Absolutely. Client education is highlighted as key informing owners about the diagnosis, or sometimes the lack thereof, the potential risks based on the mare's history, and possible complications like the chance of recurrence in future pregnancies, particularly with issues like placentitis linked to conformation.
So, given the often devastating outcomes and the limited treatment options to save a pregnancy, it really sounds like prevention is where the real effort needs to be focused.
It absolutely is the cornerstone. Your sources emphasize repeatedly that prevention is not a single magic bullet, but a multifaceted approach. It requires combining vaccination, strict biosecurity, and sound day-to-day management practices.
Okay, let's break that down, starting with vaccination. There's an EHV1 vaccine specifically for abortion, right?
Yes, there is a killed virus vaccine specifically approved and labeled for the prevention of EHV1 abortion in pregnant mares.
What's the protocol?
The typical recommended protocol described in the sources is administration at 5, 7, and 9 months of gestation. Sometimes starting earlier at 3 months is also mentioned, so 3, 5, 7, 9.
Does it guarantee prevention?
That's an important point noted in the material. No, it doesn't always prevent infection or abortion completely, but it is proven to significantly reduce the incidence of abortion during outbreaks, and importantly, it also reduces viral shedding from infected horses, which helps control the spread within a population. So it's a critical tool.
Okay. What about EVA vaccination?
For EVA, the vaccine is a modified live virus, MLV vaccine. And there's a critical point here from your sources. It must only be given to mares who are confirmed seronegative for EVA.
Meaning they haven't been exposed before.
Correct, and who are not pregnant. Vaccination should occur at least 3 weeks before any potential exposure, like breeding to a known carrier stallion or moving to an area where the virus is common and zoonotic.
So absolutely not for pregnant mares.
Definitely not. It's contraindicated in pregnant mares. And testing and vaccinating stallions is also a key part of EVA prevention, as they can be silent carriers shedding the virus in their semen.
Is there a lepto vaccine available?
Yes, a vaccine is available, specifically targeting the L. pomona serovar, which is common. It should be considered in areas where leptospirosis is known to be endemic or on farms with known risk factors, like those swampy pastures or significant wildlife contact.
What about vaccines for those common bacterial or fungal placentitis causes, the ascending ones?
Your sources indicate there are currently no specific, widely available, or reliably effective vaccines for preventing those common ascending bacterial or fungal infections. Prevention for those relies much more heavily on management and biosecurity.
Okay, which leads us right into biosecurity. What are the key practices there? Sounds crucial.
Biosecurity is paramount, yes. It involves creating layers of protection. A top priority mention is segregating pregnant mares from young horses, horses in training, or horses that travel frequently to shows or competitions.
Because those groups are higher risk for shedding viruses.
Exactly. Keeping the pregnant herd separate and stable is key. Group pregnant mares into small, stable groups if possible, and minimize commingling between groups or with outside horses.
What about new horses coming onto the farm?
Rigorous quarantine protocols are essential. All new arrivals should be quarantined for at least 3 weeks, monitored closely, and ideally tested before being introduced to the resident pregnant herd. This absolutely includes mares returning from shows, sales, or outside breeding services.
Makes sense. What else?
Hygiene is also crucial. Strict protocols for personnel and equipment. Using separate equipment for the pregnant mare area, if possible, and prompt, safe disposal of any aborted material fetal tissues, placenta.
How should that be handled?
The sources recommend double bagging immediately, clearly labeling, and submitting for diagnostics right away. Thorough disinfection of the abortion site itself is also critical. Controlling rodents and wildlife can help reduce transmission of various pathogens, including leptospirosis.
Traffic control, too.
Yes, limiting unnecessary visitors or vehicles onto the farm, especially near pregnant mare areas. Using foot baths or dedicated boots clothing for specific areas can also help.
And closely watching the mares themselves.
Yes, daily checks are vital. Being vigilant for any of those signs we discussed, fever, vulvar discharge, premature udder development. Any mare showing suspicious signs should be isolated immediately from the group.
What about during an outbreak situation?
During an outbreak, taking rectal temperatures of all in-contact mares twice daily is a key monitoring step recommended in the sources to catch new cases early.
Okay. Vaccines, biosecurity. The third leg is sound management practices. What falls under that?
Several things. Maintaining good nutrition and appropriate body condition. Minimizing stress is important. Stress from transport, overcrowding, abrupt changes in routine. Stress can specifically trigger EHV1 recrudescence in latently infected mares.
We talked about conformation.
Exactly. Evaluating perineal conformation and performing a Caslix procedure, suturing the upper part of the vulva, if a mare has poor conformation that predisposes her to ascending infections, is crucial for preventing those bacterial and fungal issues.
Anything else management-wise?
Early detection and management of twins via ultrasound is vital. Twinning is a major non-infectious cause, but it can also complicate diagnosis if an infection occurs concurrently. Effective deworming is also a general good health practice contributing to overall resilience.
And MRLS prevention specifically beyond just hoping you don't have caterpillars?
For MRLS, the primary recommendation from the sources is basically preventing pregnant mare exposure to eastern tent caterpillars, or potentially other causative species, particularly during those high-risk periods when caterpillar populations are high.
How do you do?
This might involve specific pasture management, like removing mares from affected pastures or keeping them off those pastures entirely until several weeks after the caterpillars are gone and presumed decomposed. Insecticides are mentioned as a potential control method for the caterpillars, but the toxicity risk to horses and the environment needs very careful consideration.
Right. Okay, looking ahead then, if an abortion does unfortunately occur, what's the general prognosis?
For the mare's future fertility, the prognosis is generally considered good. The infection itself is often cleared spontaneously after the abortion.
So she can likely breed again.
Often, yes. However, proper management of any complications, like a retained placenta, severe metritis, or trauma from a difficult delivery, is absolutely essential. Those complications can negatively impact future breeding soundness if they aren't addressed properly.
And for the foal, if by some chance it's born alive prematurely after one of these infectious events?
The prognosis for a foal born alive after an infectious abortion event is unfortunately poor. They are typically weak, compromised systemically, and often do not survive for long, even with intensive care.
And what about trying to maintain the current pregnancy once issues like endotoxemia or placentitis are diagnosed late term? You said it was guarded.
Yes, the prognosis is guarded, even with aggressive intervention. Furthermore, mares that have experienced placentitis, especially if they have predisposing factors like that poor conformation we discussed, are unfortunately considered more susceptible to recurrence in subsequent pregnancies. It can become a recurring issue for some mares.
Wow, okay. We've really journeyed through a complex landscape today based on the sources you've shared. We've covered this wide array of infectious causes for abortion in mares. I mean, from the silent viral threats like EHV1 and systemic diseases like EVA.
To the bacterial and fungal invaders often linked to the mare's conformation and basic hygiene, the less common protozoa.
And that truly unique environmental puzzle piece of MRLS linked to caterpillar hairs facilitating bacterial spread. That one still gets me.
It's remarkable, isn't it?
We've seen the real challenges in diagnosing these issues and why submitting the right samples, the whole package, chilled not frozen, is absolutely paramount.
And we've definitely highlighted that prevention requires this multi-pronged strategy. It's not just about vaccines, but really rigorous biosecurity and proactive management that needs to be tailored to the specific risks on any given farm.
So thinking about the sheer variety of causes we discussed today, from common pathogens we actually have vaccines for, to subtle physical vulnerabilities like a mare's vulvar seal, right down to these complex environmental links like caterpillars acting as Trojan horses for bacteria. What does all of this tell you about the deep interconnectedness of health, management, and the environment when it comes to the delicate process of successful equine breeding?
It really underscores that you have to look beyond just the obvious pathogens sometimes. Seemingly small details in management, unexpected environmental factors can have truly profound consequences on reproductive success.
Absolutely. And maybe for you listening, which aspect of prevention, having heard all this, feels like it would be the most critical or perhaps the most challenging to implement effectively on a large scale? Is it the vaccination compliance, the day-to-day biosecurity discipline, managing stress, dealing with environmental factors like caterpillars, or maybe addressing conformation issues? Something to really consider. Thanks for bringing these sources and insights for this deep dive today.
My pleasure. It's a critical topic.